of the okay, one of the Mutraghata with and I found that amazing results I could make out, not with the surgeries, but without surgery also I could give result to the patients. And that made me to think about the Mutraghata. And then I started working on the Mutraghata, trying to understand what exactly Mutraghata as per Ayurveda. And what the modern diagnosis, contemporary diagnosis can be clubbed under the Mutraghata. That was the thinking with what I started. My journey to understand the Mutraghata, and whatever I could understand, I am trying to share with you people today. And hope this particular session will help you to think with a different perspective regarding the Ayurveda surgical disease especially. Okay. So let me share my screen. Okay. So before I could start my presentation, I would like to thank all of you for being here and trying to invest your time and to learn something new. Maybe you may be knowing many of the things, but still, it will be when we together we make an what you call an assembly, especially with the intention of learning something or contributing for the knowledge of each other. Then for that, I need to thank all of you. And at the same time, I would like to thank the Kuladevata and Lord Dhanvantari for giving us this knowledge and the medicine to help others, and the Sushruta, the pioneer of the surgery, and all my teachers. And I do acknowledge Yadavji Trikramji Acharya for because I read his what is the compilation on the Dalantika of the Sushruta, and Jack W. McAnich and Tom F. Louis Smith Tenago's General Urology they have edited, and I went through that book, and all my patients who really believed in me and they could give me an opportunity to treat them. Okay, after saluting all of them, let me really start with the Mutraghata, what exactly we mean. See, when this topic was, whatever the other analysis we are going to do in this next 60 minutes, that is, I'll be putting some lights or some of my understanding regarding the etiological factors and the management of the Mutraghata, and especially in the perspective of the contemporary diagnosis. So why, as I told you already, the when I could started treating benign prostatic hyperplasia patients, that too who were posted for TURP with our sister concern hospital, but as they were in the waiting period to be operated, even with the indwelling catheter in their bladder, when they came to me, in that period, when there is a waiting period for them, because they were enrolled under the different schemes of the government of India or the government of Gujarat, where the medical reimbursement was supposed to be taken, and for that they need to have an approval before the surgery. Okay, that is a process. So they were waiting for that approval and the posting of the surgery. The schedule was supposed, they were waiting for the surgery to be scheduled. And in between, they came to me because as we, the adjacent building were there when I was in Parul. Okay. So in that period, the 20 days, whatever they were having that window period for the surgery to be posted, they just wanted to try whether anything can be done with Ayurveda. So even I started without a clear picture about the BPH and the clinical, what you call the management of the BPH from the Ayurveda part. But still, I accepted the challenge. And only basic thing what I learned from a Guruji is, as I told, I'll be coming with the next my seminar about my ADP formula. Okay, ADP formula. I'll elaborate in the next session whenever I'll be coming with that ADP formula. Okay, so my basic funda regarding Ayurveda is whatever the diseases are there, majority of them, they are because of the Prokopa or the Vimargamana of the water. Isn't? So many of them, you can, even in Anatmaji Vadis, if you see, the number of Vata Vadis is more compared to Pittaja and Kaphaja Vadis. Isn't? So the basic thing, when I thought that there is a Vikriti of the Apana Vata and I need to correct it, that's all. So anyway, surgery is there. Surgery is an ultimatum. Last at the end of the day, he can go undergo surgery. But before that, why can't we start? And another thing, what made me to think about going for medical management of the surgical disease, which is posted for TURP, is surprisingly, Sushruta has never mentioned any in the Mutraghata Adhikara or in the Mutrakrishra Adhikara about the surgery. So that made me to think about why the pioneer of the surgeon surgery, the father of surgery, whom we regard, why he didn't mention any of the surgery for Mutraghata and even for Mutraghata for that matter. So with these two particular basic in the things in my mind and believing in the Ayurveda, mantra sampravaktavyam na mimamsa kadachanaha. Okay, so believing in Ayurveda with 100% trust, I started with a treatment, especially with the Basti. And that Basti, what I used was a Dashmula Kashaya Yoga Basti. There was in a Niruha, there was Dashmula Kashaya I used, and in Anuvasana, I used Dashmula Taila. And to my surprise, on the 7th day, I could take out the catheter of the patient who was on catheter for the last 2 months and who was having only remedy as per the contemporary science to be operated for the prostatectomy. And that fellow who was not able to pass urine, the retention of urine was there, he started passing the 11.2 ml per second urine. So urophlowmetry could show on the 7th day, once I could take out the catheter on the 7th day of the Basti, after the Basti treatment. Okay. Of course, Yoga Basti was supposed to was the 8th day, but I took it on 7th day itself. Okay, the catheter. And I could see that there was a good amount of urine flow was there. There was a good stream was there. And that you can see the normal urine flow rate should be 15 ml per second. And this fellow who was on catheter, because of not passing even a single drop of urine, was able to pass 11.2 ml per second. So this made me to think about this particular topic on Mutraghata, which I never neglected a lot in the earlier even in my post graduation also. I never went through this particular topic with this one with what you call the more importance or with a concern. Okay, but this made me to think about this, and that made me to think about the Mutraghata, and because of that, I could make out there is some role, there is some what you call the remedies are there which can be used for the many of the conditions of the contemporary science, which can be clubbed under the Mutraghata, and where the surgery is not a mandate, there we can try with the Ayurveda. Okay, so the Pareto rule, what the Pareto rule says is the 20-80 rule. So 20-80 rule, it was my principle. The 20% of your very foundational, very correct knowledge can yield you 80% of the result. 80% of the additional, what you call all the factors will contribute, and you will get 100% result. So you need to have at least a specific foundational knowledge about any disease for that matter, or any particular treatment for that matter. That is at least 20% of a foundation, a strong foundation you need to have. Okay. So this Pareto principle has changed my perspective regarding Ayurveda, because many times as an Ayurveda surgeons or Ayurveda postgraduates, we always feel that the Ayurveda has not means it doesn't have much 100% result, 100% remedies, and because of that we neglect it. See, even if you use 20% of that Ayurveda, proper knowledge and with the proper principles, and applying the Karya Karana Siddhanta, following the Karya Karana Siddhanta, Samanya Vishesh Siddhanta, Karya Karana Sambandha, we can achieve 100% result. So we need to work only on the 20%, on understanding the Samprapti, understanding how the Samprapti can be broken with the available resources which we could understand in the Ayurveda. The available medicines which are available in the market. Okay, so this Pareto rule has helped me to understand Mutraghata in a more better way. So in this session, I will be covering, okay, the Mutraghata, specifically with the Sushruta's perspective, because even Charaka has got his own this a varying number, and Agvata is also having the other names. But I would like to because of the time constraint, and because I'm a Shalya person more acquainted with the Sushruta Sanhita, that's why Mutraghata as per Sushruta I will be highlighting. So Charaka aspect and Vagbata aspect are not covered in this one. Okay. And I'm trying to correlate the contemporary diagnosis, and it is my probable correlations, not 100%, may not be 100% correlations. And some of the out-of-box interpretations I may give, you may accept, you may not accept, but you need to think over that. But if you agree with that, or once you think, you can come back to me and you can appreciate me. If you do not agree, you can communicate with the same thing with more justifications why I am not right. Okay. So what this session doesn't cover is the Mutrashmari, I'm not going to touch. Mutra Sharkara, I am not going to touch. Mutra Kritra, Mutra Udavarta, Urkagata, and Bastigata Vidradi, I am not going to touch. Okay. Even Charagavagata version, I am not going to, as I told. And basic clinical examination, investigation of urology, I am not going to touch. Because totally I'm focusing on Mutraghata. Okay. And I believe that the people who are all watching this particular or attending this webinar live, or who will be watching it on YouTube, you will be aware of the basic anatomy, basic physiology of the bladder, and the urinary system, and the investigations related to urinary system. Okay, for that reason, I am not going to cover it. And Mutraghata as a complication also, I am not going to touch, because it is as a secondary disease for the secondary to other some disease. Okay, so basically Mutraghata, which I generally consider it as urological disorder. So Sushruta has mentioned 12 types of Mutraghata. 12 types of Mutraghata. Charaka has got another additional one, and Vagbata is the same number, but the names vary. Okay. As I told, Mutrakritra, Ashmari, I am not going to touch, but still they are considered under the urological disorders. Mutrakritra, Mutra, Ashmari. Okay. So basically, Mutraghata, they are told as the Sushruta, as per Sushruta, and they are Vata Kundalika, Ashtila, Vata Basti, Mutra Titas, Mutra Jatara. Okay, Mutra Sangha, Mutra Kshaya, Mutra Granthi, Mutra Shukra, Ushnavata, and Mutra Oka Sauda is two types. Okay, that's what told. Okay, so you can see the names here. Okay, so the Vata Kundalika, Vata Ashtila, Vata Basti, Mutra Tita, Mutra Jatara, Mutra Sangha, Mutra Kshaya, Mutra Granthi, Mutra Shukra, Ushnavata, Kafaja, Mutra Oka Sada, as I told, Mutra Oka Sada, two are in number. One is Kafaja, another one is a Pittaja. Okay, so basically where it is occurring, where this Mutraghata is going to affect. So Vektasthana and Samprapti is basically in the Shroni, that is the pelvic area. That's why Basti, Bastisira, Medra, Kati, Purushana, and Payava. So whole pelvic cavity and all the organs, especially genitourinary organs, as well as what we call the what do you call the rectum. Even rectum can be considered, because Payavaha refers to the anal region, or the defecation of the stools. Okay, so all these areas, which especially fall in the what you call the pelvic girdle, pelvic cavity, and you know that it is Apanavata sthana. Pakwasha is Apanavata sthana, and because of that, this disease finds more role of the Vata and Apanavata, and especially in the area where all these organs are lying. That is Basti, that is bladder. Okay, bladder, then the trigone of the bladder, the urinary ureters which are entering into the bladder, then the testicles and vas deferens, and the what you call spermatic cord, and in case of males, okay, and gudasti vivarashraya, and even the rectum and anus. Okay, so the basically the urinary system is made into three zones: that upper tract, mid tract, and the lower tract. Okay, so upper tract, kidneys and its blood supply, and adrenal and suprarenal glands and ureters are included. Whereas mid tract, bladder is included, and the lower tract, vas deferens, seminal vesicles, verumentum, prostate, urethra, and testicles are included. So now basically we are focusing on the mid tract and lower tract, even though the upper tract we may not be concerned with the kidneys and the other, but the GIT we are going to take, because the basic pathology as per Ayurveda starts at only two areas, either Amashaya or Pakwashaya, or both. Amashaya Samutta, Pakwashaya Samutta, or Amashaya and Pakwashaya Samutta, Ubhay Samutta. So the disease is originating at the GIT. Okay, even at the GIT. So in our upper tract, we can consider the whole GIT. Okay, so there is that's because of that. Why I have told you the upper tract, the GIT should be considered, is because many of the symptoms of the urinary system, they are common. They are mimicking as of an abdominal conditions, isn't it? So you can see the abdominal pain will be there. Okay, and the nausea will be there, and the cramps will be there, and even back pain will be there. So many of the things, they are common with the symptoms, and the complaints will be common with the GIT as well as the urinary system. That is because of this rhinoenteric reflexes. The nerve supply, the innervation is common for both the what you call the abdominal organs as well as the urinary system, urogenital system. Okay, so there is a common autonomic and sensory innervation is there for the two major systems, and they are major splanchnic nerve, lesser splanchnic nerve, minor splanchnic nerve, inferior mesenteric ganglion, inferior hypogastric ganglion, and vagus nerve, which is sensory to esophagus, stomach, small intestine, colon, and of course the bladder. Okay, so because of this, what happens? The complaints, they mimic, and because the differential diagnosis happens to be the more important, especially clinically. So clinically, of course, the abdominal examination can reveal you many of the things. Okay, so that I'm not going to deep into that, but you need to understand that there is definite connection between the genitourinary system and the GIT system. Okay, and you keep in mind, because when I come to the treatment aspect, you'll understand how it can help, how the basti can help the in the Mutraghata. Okay. So as I told you, the gastrointestinal symptoms of the urological disease are like it mimics, like it gives rise to what you call the peptic ulcer syndrome, gallbladder disease, appendicitis, like pain, and other specific gastrointestinal disease are also concurrently may be presented with the urological disease. Okay, because the inflammation, even though it is retroperitoneal organs, the kidney, as even the bladder is of course in the what you call the intraperitoneal, but their inflammation can cause the peritonitis, and because of that the symptoms they become common. Okay, so the basic what you call the common signs symptoms of the urinary systems, all of you know already that there will be local or referred pain, local and referred pain will be there, kidney pain, especially in the loin region, ureteral pain, which will be radiating down, vesical pain at the hypogastric region, prostatic pain at the pubic area, and testicular pain, of course, in the scrotum, and even abdomen also, because intra-abdominal also pain will be there, and epididymal pain. So these are the common what the complaints with what the patients they go to urologist. Okay, urologist, or they are referred to the urologist. And the basic common symptoms, especially related to urination, are the frequency. So usually the increased frequency that will make the patient to go towards the what you call the urologist or the doctor, whoever. They feel better, they go easily. Okay, so the frequency of the because of the increase, the diminished bladder capacity, or that inflamed bladder will be it has got its own functional lacia, and because of that there will be increased frequency of the micturition. That is one aspect. Another aspect is that there is obstructive uropathy is there, and because of that the complete evacuation or complete emptying of the bladder is not taking place, and because of that the urine, even after the voiding, the residual urine volume will be more compared to the normal individual. So because of that, even as the glomerular filtration is continuously going on, the bladder is going to get all the urine continuously, and because of that, even once the little amount of urine gets collected, again the stress receptors are what you call stimulated, and the patient will have the what you call the urinary symptom, or sorry, the urinary reflex or the urination reflex. So nocturia is another complaint with the patient who they go to the consultant. Urgency, patient is not able to suppress the urge or hold the urge till he attends the washroom, and dysuria when the burning pain or the painful urination is there, and anorexia is the bedwetting. Okay, so when especially this bladder outlet obstructions can be considered as a Mutraghata. Okay, because there is a basic difference there in the Mutraghata and Mutrakritra. Mutrakritra, we can consider the pathologies, problems which are more related to the upper tract. As I told, the tract, what we make, the what we call the urinary system. So the Mutrakritra, most of the time, majority of them, they are at the upper tract. The pathology is lying in the upper tract, and some of them they are of course at the lower tract. But Mutraghata, especially, it is more with the bladder. It is more to do with the bladder. Okay, because all the told Mutraghata, once you go through the lakshanas, you can make out that this is more focused on the bladder outlet obstruction, or you can consider the bladder means related pathologies. So usually in Mutraghata also, it has been shown hesitancy is there, loss of force and decreased caliber of the system is there, terminal bleeding may be there, urgency, and acute urinary retention, chronic urinary retention many times, and interruption of the urinary stream, sense of residual urine, and cystitis. These are the common what we call the symptoms with the bladder outlet obstruction. And surprisingly, the same features, same complaints appear in the either of the Mutragatas. Okay. So what are the conditions which come under the which lead to these complaints are the one is bladder neck contraction. It may be BPH, it may be acute prostatitis, it may be bladder outlet obstruction or bladder neck stenosis. It can be chronic retention because of the infection. It can be neurogenic bladder, maybe overactive or atonic bladder, stricture urethra, oliguria, and vesical benign growth and stone, retrograde ejaculation, cystitis, urethritis, posturia. All of them, they can lead to either any of these particular symptoms which we discussed earlier. Okay. So the common etiology as per the modern urology is the obstructive pathologies, especially benign prostatic hyperplasia, which is more common. Okay. Cancers or benign tumors of the bladder or the bladder neck, dehydration, infection of the urinary tract, interstitial cystitis, kidney disease, kidney or urinary tract stones, post-vasectomy syndrome, sexually transmitted disease, and trauma or injury. Okay. So when it comes to Ayurveda, he particularly emphasizes on the Vegadharana. So that's why we should understand how much it is important that Vegadharana, which is a neglected part, which we do not prescribe even in our clinic. Many of us, we practice Ayurveda. We may practice integrated medicine, but still many times we fail to evaluate, inquire whether the patient is indulging into Vegadharana. The Vegas which are not supposed to be stopped, suppressed, if whether the patient is suppressing those Vegas, that should be inquired particularly, especially in case of Mutraghata. And you will find, definitely you'll find the incidences of suppression of the urinary urge in almost all the patients. So that's why he says that adhovatasya rodhena. So even adhovata obstruction means all the three. That is either adhovata or purisha or mutra or even shukra. If any of these four vegas are suppressed, that may lead to all the disease which are pertaining to apanavata and especially the what we call the basti vikaras and medra vikaras or vankshana vikaras. Okay, so basti, bladder you can compare, medra, genitalia, and vankshana, that pelvic cavity. Okay, so we are supposed to look into these, whether the Vegadharana is being practiced by the patient, especially with relation to Mutra, Purisha, Shukra, and Adhovata. Okay, so because of that, what happens? The patient will experience the even inflammation. Simple Vegadharana over the period can cause inflammatory conditions in the related organs which are involved in that particular physiology. Okay, so we need to think about that, and unless, see, that's why I am telling you, unless you clear the nidhana, chikitsa cannot be acquired, chikitsa phala cannot be achieved. That's why we need to rule out the basic causes, causative factors, etiological factors for any of the disease. And here in this case, in Mutraghata, you need to help the patient, encourage the patient to realize that how much important it is not to suppress either Mutra Vega, Purisha Vega, Adhovata Vega, or Shukra Vega. Okay. So the same has been emphasized by the modern people. Okay. The Greenfield and Van in 2000, okay, but they have found that when there is a voiding dysfunction is there, especially with the urine. Okay, so abnormal voiding habits have been associated with reflux, vesico-ureteral reflux. I am speaking about the reflux at the vesico-ureteral junction. Vesico-ureteral reflux, that is what the margamana of the vata. Udavarta of the Basti, Udavarta of the Vata, Udavarta of the Mutra. Okay, so reflux due to high voiding pressure, bladder overactivity, and poor bladder compliance consequently leads to primary reflux. So this is what is happening with the Mutraghata. In Mutraghata, the structural changes are later, but initially the physiological the changes, pathology, what the pathology happens is at the physiological level. So abnormal physiology because of the what you call the intentional voiding dysfunction. Okay, intentional voiding dysfunction is going to cause the Mutraghata first, and the consequence will be followed by the structural changes. That's why Sushruta says that has mentioned it as the Basti has been mentioned, not the surgery. Because maybe in those days, the people may be much aware about these particular, they may be social practice. There may be these may be social practice not to suppress the Vegas. So maybe because of that, he may not have come across the conditions where the gross structural changes have taken place, and because the surgery would have become the mandate. That may be another reason why he may not have mentioned the surgery in the Mutraghata, because he mentioned the surgery over the bladder in Ashmari, but surprisingly, he doesn't mention surgery in the Mutraghata. So that is the point where even the the lifestyle changes. Okay, and if the initial identification has been done, and because of that, if the lifestyle changes can be adopted, the Mutraghata can be treated with the medicine, with lifestyle changes, and without surgery. Okay. Okay. So usually there is a 20 to 40 centimeter of water pressure is there. Okay, when there is urination is supposed to occur at the intravesical, that is called as intravesical pressure at the detrusor muscle. Okay, but when it comes to the bladder neck obstruction hypertrophy of the vesical musculature, it develops, allowing the intravesical voiding pressure to rise 50 to 100 centimeter or more of water in order to overcome the increased outlet resistance. That means earlier it happens to be only physiological, but once there is a structural changes occur, then it becomes a mandatory for it to compensate to help the bladder to contract and uh, dispel the urine. The pressure goes up. That is 50 to 100 centimeter of water pressure. That is again, the increased intra-bladder pressure can be correlated to excessive functionality of the vata or the vata vimargamana. Because vata has to move in the urethra, but is not moving in the urethra, and because of that, there is a accumulation of more and more and more and more of vata, and because of that, there is the conditions which lead to vata kundalika, okay, basti jatara, all those conditions. Okay, so the nidhana Charaka has mentioned is ati vyayama tikshna aushada ruksha madhya prasanga anupamasya Adhyashana Jajana. So all of these, see, all of these Nidana, if you see, they are at the level of the Amashaya or Pakvashaya. That's why I was telling you the disease, even though Mutraghata is at the bladder, but the origin, the etiologies are more towards vitiating the Agni, vitiating the Vata, vitiating the what you call the doshas and the Agni at the level of the Amashaya or Pakvashaya. Because of that, what happens? The patient is going to have the Mutraghata, and because this is good thing that the pathology at the Amashaya and Pakvashaya, and we can correct it by either of the Panchakarma or medicine. Okay. So the first condition is Vata Kundalika, where I tried to compare, but I could once I went through the things, I could understand that the conditions which are existing in the modern urology, the diverticulum of the bladder outlet obstruction, vesicular reflux, these all have the same complaints or the same symptoms as of the Vata Kundalika. Okay, so here, as I was telling, the increased what we call the pressure, intravesical pressure, 50 to 100 centimeter of water pressure, if it is increased, that is Basti Madhyam Ashrita. Basti Madhyam Ashrita. That is how the Vata becomes Gulmakara, and that causes the what we call Vata Kundalika. Okay, so the patient will be having, the complaints, which is there is Raukshata when the patient is dehydrated and more, and at the same time, if he practices the what you call the dysfunctional widening, it will lead to this the increase in the intravesical pressure, and secondary to that, the morphological changes. Okay. And Vega Vigatha, see, I was telling, constipation, widening dysfunction. Okay. And because of that, Vayu Antaramashritam. So diverticulum may happen if the musculature of the bladder, if it is weak, there can be a diverticulum. Okay. So here it can be Gulmakara. Vayu itself becomes what you call the Gulmakara. That is intravesical pressure increase, 50 to 100 centimeter. Okay. This that can cause over the period, this can cause cellulose. What about cellulose? That is, a mucosa is going to be pushed in between the superficial muscle bundle of the divertical, what you call detrusor muscle, and that will cause the small pockets, and they are called cellulose. So the surface, the mucosal surface is getting embedded, and that is getting inserted into the what you call the muscle fibers of the detrusor muscle. And because of that, the muscle will lose its strength, the muscle will lose its tonicity, and that become flaccid. That is what called as the incompetency of the detrusor muscle. Okay, so these things, this particular basic pathology, it remains same with all the Mutragatas. Okay, so only the Lakshanas will change. But this basic pathology, which is going to cause either diverticulum or going to cause the vesicular reflux. So basic pathology is what? There is increased intravesical pressure with 120 to 150 centimeter of water, and at the same time, over the period, it causes the structural changes in the form of cellules, okay, or the trabeculation, and that causes the diverticulum or the vesicular reflux. Okay. Mutram charti sangraham, that is urine retention will be there. Srujad alpam sa rujaskam shanai shanai. Thus, dribbling and dysuria can be seen in the Vata Kundalika, and the same things can be seen in diverticulum, bladder obstructive, what you call the outlet obstruction, vesicular reflux. The second is Vatastila. Many of us, we consider it as a benign prostatic hyperplasia, but it cannot be only BPH. The Vatastila may not be only BPH. Kindly given attention. It can be because what he has said, Ashtilavad Ganam Granthi, Karotya Achalam Unnatam. Achalam Unnatam. So it is non-mobile, and it's a stony hard in consistency and swelling. And that cannot be only BPH. That cannot be only BPH. It can be vesical tumor overlying the bladder neck. It can be local extension of the carcinoma of prostate or cervix into the base of the bladder. It can be metastatic nodes from the cancer of the prostate or the cervix. It can be retroperitoneal fibrosis or malignant tumor. So we need to think like that. So because that means you need to rule out the what we call the more life-threatening conditions. That's why in the medical, we should have a dictum. We should follow dictum. First think the worst, then the better. First rule out the worst conditions by available investigations from the contemporary science. And accordingly, you will be left with, you will be very much at the position, authority position to deal with the Mutraghata from the perspective of the Ayurveda. If there is a metastatic nodes are there, if there is a vesical tumor, a CA of the prostate, okay, which has extended from the extended into the bladder, there if you go on giving the basti, it is not going to help. It's not going to help because it requires the corrections, surgical correction. So you cannot claim there the Vatastila is failed or the basti treatment in the Vatastila failed. When you want to claim the basti treatment to be effective in Vatastila, you should confirm it is only a benign growth, either of the bladder or of the prostate or on the surrounding or at the bladder neck. Okay. So Vinmutra Anila Sangascha, again there is obstruction for the urine flow as well as the even many of the time patients suffer with the constipation. So that is what the severe constipation can cause bilateral hydroerythronephrosis. That's why I was telling Payavaha. It has been included in the pathology, in the main classical shloka, what I told, Payavaha has been included in the Mutraghata. So Payavaha is where the loaded rectum can cause bilateral hydronephrosis from the compression of the lower ureters, and even enlarged prostate and other infiltrating pathologies can affect vice versa. So if the obstructed urine flow can cause the constipation, and because of that the patient will have loaded rectum, and even loaded rectum can cause internally the what you call the urinary what you call the vata vimargamana, and because of that urine retention can take place. So that's why the vata still both the conditions can be possible. Admanam bastav. That is, again, I told you, the intravesical pressure increase. Third is the vata basti, which can be, I'm not sure. But my thought is that whether chronic urinary retention or the vesicular reflux can be considered. Vesicular reflux, definitely, because if you see the conditions, okay, where the Vega Vidharana is there, reason is there, then there is a Nirunadi Mukhathasya Baster Bastigato Anilaha. There is a obstruction at the Mukha of the Basti, and because of that, there is a increase in intravesical pressure, that is Bastigato Anilaha. That can be because of the outlet obstruction. And outlet obstruction can be from the acute prostatitis or urethral stricture, okay? And because of that, there will be abnormally high voiding pressure, and that may cause the bladder overactivity leading to vesicular reflux. Mutrasango mutrasya apravartihi. Why the mutrasanga? Because mutrasanga, okay, where the obstruction is there from the externally, okay, at the bladder outlet there is obstruction, and because there is mutrasya apravarti, and at the same time there is a reflux. The urine is being pushed backward in the ureter because the poor bladder compliance. Okay, that is the primary reflex. That's why the reflex can take place. Okay, and the Bastir kuksher nipidam vidayate yasyata sthatata nipiditam nipidinam vedanatyartha. Okay, so there is lower abdominal pain will be there due to chronic urinary retention or acute retention. The rhinointestinal, what you call the rhinointestinal reflux will take place, and because of that abdominal pain will be there all over the abdomen. That you can call it as a Udavarta leading to Gulma. Or the Udavarta at the, and the Udavarta Vata can go and cause the pain at the five places of the Shula. Okay, Udara Shulas. Secondary pyelonephritis can be the cause. And Krichra Prasada, it may lead to secondary pyelonephritis, and Krichra Prasadana Kashta Sadhya. So vesicular reflux is Kashta Sadhya, because it is causing the secondary pyelonephritis also. So infection may occur. Okay, so that is the the basic things. What happen is, in the pathology, there is outlet obstruction is there, and because of that there is a reflux, backward movement. That is what Udavarta, what our science has told. Okay, our science has told. Okay, so Mutratita, the fourth condition in Mutratita, this particular whatever has been mentioned in the tika, that is nabeti mutra nagachati tartah pravahati iti nikuhana adityartah. So patient is not able to even strain many times. Even if he trains, he is not able to strains, he is not able to pass, and because of that, there is distension of the bladder. Nabheti mutram, that is the bladder distance even up to the umbilicus. So this is more usually seen in case of neurogenic bladder. Okay. So cause is again same. Vega sandhare mutrasya. Okay. Bhuya punah sustam ichchati muktam muvanchati. That is ablation of micturition reflex. There is no micturition reflex at all. Nabeti mutram nagatyartha, distension of bladder up to umbilicus. Prato mandarujam alpam punah katanchit sampravartate. Overflow incontinence will be there. The patient is not passing on his own. There is a neurogenic bladder is there, atonic bladder is there, but there is a overflow incontinence is there, because once the bladder gets distended, automatically the overflow will take place, and that is called overflow incontinence, secondary to flaccid bladder. And the intravesical pressure equals urethral resistance, and urine and then constantly dribbles forth, because already there is increased intravesical pressure is there, and that equals urethral resistance, and by that there is a little bit dribbling will be there. Okay. The fifth point is, the fifth condition is Mutraghata, which can be considered compared to acute retention of urine. Okay. Acute retention of urine. And in the condition is, the problem is, again, pavana prakopa karanam. That is vata prakopa. balavad vigrahadikam manyate. And especially the obstruction of the vata by balavat, vega vidharana. Okay, so acute retention of urine can result because of again mutrasya vihate vege, suppression of the micturition urge, abnormal voiding habits as I already described. Tada tadudavartho mutra udavartho, that is vesicular reflex is there. Mutra udavartha is psychoureteral reflex. Because mutra is being pushed back into the ureter, isn't it? That is vesicular reflex. That is a mutra udavartha. That has been told in our classics. Mutra udavartha is vesicular reflex. That is mutra jatara. Okay. Nave radho bhage tivra pida madhmanam janayet. There is pain due to distension, pain secondary to cystitis, acute retention of urine. Okay. Or bladder outlet obstruction is there because that there is cystitis and because that there is severe abdominal pain. Mutra jatara madha sroto nirodhanam vidayet. Mutra Purusha Marga Avarodhakam Janaditartha. So this can lead to Mutra Purusha Marga Avarodha. That is, again, as I told you, there may be the causes at the lower end. That is Mutra Jataram Adaha Sroto Nirodhanam. That is again indicating towards the bladder outlet obstruction. Mutra Jataram Adaha Sroto Nirodhanam. That is bladder outlet obstruction. So it can be BPH, vesical tumor, as I already considered all the things which in the Mutrastila, the same thing can be considered here. Causes as a cause. And metastatic nodes and the retroperitoneal fibrosis or malign tumor. Okay. Coming to the sixth one, that is Mutrosanga. That is anuria or acute nephrotic syndrome can be compared based on the what the classical complaints are there. That is anuria or acute nephrotic syndrome. Of course, as I was telling you, that the Mutraghata usually refers to the pathologies of the kidneys, and anuria you can consider there. But when it comes to only visibility, where the urine is not seen, passed, that also can be called as anuria, even though in this condition, bladder is palpable, but urine is not coming out. That is what we need to consider as anuria here. But when the modern anuria happens to be no formation of the urine itself, and that should be considered for the Mutraghata. Even some of them, they consider Mutraghata as the what you call the renal failure. Again, there is a debate. Okay, so Mutrosanga is Basto O Apetha Nale Mano. So here the pain is at the bilateral ureters as well as the prostatic and urethral obstruction will be there. Okay, and Nale Mano means at the glands also there will be pain. Mutra Pravrutam Sajjit Saraktama Pravada. There will be hematuria. So in this condition only you can see the hematuria. Hematuria, acute nephrotic syndrome. In that condition, that you can see these signs changes. The straining for micturition will be there, and bilateral renal arterial venous occlusion. Because of that, there is a acute nephrotic syndrome is there, and hematuria can occur because of the bilateral renal arterial or venous occlusion. RBC cast can be seen in case of acute nephrotic syndrome in the urine. Okay, so as the blood is coming in the urine, hematuria is there. Okay, and that's why in acute nephrotic syndrome also the hematuria is one of the presentation. So we can consider acute nephrotic syndrome in this condition. Okay. Sarvecham anarapam sarojam wa atha nirujam. Pain due to distension or pain secondary to cystitis, and there will be oliguria and edema. Saraktamava pravata nirujam. Painless hematuria can also occur. Okay. There is a painful as well as painless. Both the hematuria can occur in this condition. And viguna anilajo vyadihi. Viguno anilajo vyadihi. That is the whatever the viguna anila, that is vitiated vata is there, that can cause other systemic disease like hypertension, proteinuria, uremia, as it is seen in acute nephrotic syndrome. Okay. So as the thing what you would like to, these things you need to keep in mind when it comes to painless hematuria. Okay, painless hematuria can be classified, which are occurring in the, what are the pathologies in kidney, which can cause painless hematuria, what are the pathologies in ureter and bladder, what are the pathologies in prostate, and what is the pathology in urethra, which can cause painless hematuria. Okay, so kidney, glomerulonephritis, infective endocarditis, renal TB, benign familial hematoma, immunoglobulin A nephropathy, severe acute pyelonephritis, papillary necrosis, renal cell carcinoma, microscopic polyangiitis, and PCKD, polycystic kidney disorder. This can be the reason for the painless hematuria. But we are concerned about here in the Mutraghata more about the bladder. Okay, so bladder, again, the trauma, neoplasm, and cystomeiosis should be ruled out. In prostate, prostatitis can cause the painless hematuria and neoplasms and urethra trauma. Okay, coming to the seventh one, Mutra Sankshaya, that is oliguria, secondary to intestinal obstruction can be considered. That can be considered, that is a query. Because many a times, when an acute intestinal obstruction occurs, we see oliguria. And the lakshanas, what have been given here, okay, Rukshasya, Klanta, Dehasya, Bastistau, Pitta Maruta, Sadaha Vedanam, Kushram, Kuryat, Mutra Sankshayam. So, Rukshasya, hypovolemia. Okay, so weight loss may be noticed when a renal insufficiency due to obstruction or infection supervenes. That can also cause that can be considered, whether that can be considered Ruksha. Then, Klanta Dehasya, Klana Dehasya, shock. Patient will be in the, what you call the shock status. Na pitta prakopa karanam. Tatapi vatanvita pittasya prakopam deyam. So even though there is a pitta prakopa karana is not there, but only vata prakopa karanas are there, but still there will be what you call the pitta samsarga will be there with vata. And this visual seen in case of acute glomerulonephritis, acute tubular necrosis, acute interstitial nephritis, CHF, and cirrhosis. These can cause these same lakshanas. And Sadaha Vedanam, peritonitis, pancreatitis, intestinal obstruction, in all these conditions, there will be Sadaha Vedana at the abdomen. Sadaha Mutra Kuchram, even dysuria, the Sadaha, burning micturition will be there. Okay, that is because of the acidic urine, reduced urine. Okay, the less quantity of urine can cause the acid, pH, increase in the pH, decrease in the pH, that can turn into acidic urine. Okay, so eighth, Mutra Granthi. This is a very interesting one, Mutra Granthi, because the basic pathology, as I was telling, trabeculation of bladder wall, cellules formation, diverticular formation, mucosal, what you call the hypertrophies, all these things are the basic cause for the, what you call the chronic Mutraghata. Which will show the morphological changes. But before this could occur, it is only Kriyatmaka, that is functional entity. So Mutra Granthi, okay, there the trabeculations will take place. That is Abhyantare Basti Mukhe. Abhyantare Basti Mukhe Urutto Alpaha Sthira Evacha Vedanavanitah Sada Mutra Margani Rodanaha. So this is a beautiful, what you call the explanation has been given. Beautiful explanation has been given. Abhyantare Basti Mukhe means inside the Basti. Urutto Alpa, there is circular, okay, circular, what you call, the structures are there. They become sthira, they become hard, they become hypertrophied, okay, and they can become painful many times, and they will obstruct the urine flow. That is what the trabeculation. So there is a hypertrophied muscle bundles of the bladder wall, which may cause, and at the same time, there may be a diverticular, which can also cause the same thing. That urutto alpa, diverticulum can also be urutta alpa. So it can be a diverticula, bladder diverticula. It can be, when it is sthira eva, it can be hypertrophied muscle bundle of the bladder wall. That is what we call trabeculation. Okay, it can be cellulose. Okay, it can be bladder wall mucosa, which will be leading to a decompensation of the detrusor muscle, increased pressure, which will push the mucosa between the superficial muscle bundle, causing the cellulose. Under this hypertrophy of trigonal muscle and interureteric ridge will cause the increased intravesical pressure. Okay, and this trigonal muscle and interureteric respond to the obstruction, and the ridge then becomes prominent. That is, trigonal ridge becomes more prominent. That ureteric ridge becomes interureteric ridge becomes more prominent. Okay, trigonal muscle and the interureteric ridge becomes more prominent. And because of that, we call it as a trigonal hypertrophy, causing increased resistance to urine flow in the intravesical ureteral segment. Okay, it is this mechanism that causes a relative functional obstruction of the uretero-vesical junction. So at the uretero-vesical junction also there is obstruction, and at the urine bladder outlet also there may be obstruction. And whatever the obstruction you are seeing at the uretero-vesical junction, that is because of the hypertrophied trigonal ridge of the muscle. That leads to back pressure on the kidney, and that causes the hydronephrosis. The obstruction increases the presence of significant residual urine, and because of that, patient will feel there is a what you call the urine still not emptied. And this particular, when the structural changes takes place, then that condition can be called as Mutragranthi. Okay, Mutragranthi. So the bladder tuberculation, it is a hallmark of bladder outlet obstruction. As the obstruction is there, then there becomes it's a compensatory mechanism where the thickening and hypertrophy of the muscle of the destructor takes place, and that they are called trabeculations. Okay, so when the hypertrophy, individual muscle bundle become taut and give a coarsely intrusive appearance to the mucosal surface. So the muscle layers, they become what we call the hypertrophied, and they become taut, and because of that, they're like interwoven what we call the mucosal surface will be seen, and that ridge becomes then more prominent, and that trigonal hypertrophy causes increased resistance to the urine flow from the ureter to the vesicle, and because of that, there is again retrograde pressure on the kidney and cause hydronephrosis. So you can see the bladder wall trabeculation in this endoscopic picture. Okay, so you can see here the bladder wall, the trabeculations. You can see here before that, this one. These are the whatever ridges you are seeing here. Okay, the hypertrophied ridges and the mucosal line. Okay, you can see that intervened here. They are all the trabeculation. You can see here. It's more clear. The arrow is showing here. Okay, these are the trabeculations. These are trabeculations. Okay, so the trabeculation usually it can be because maybe even the obstructed bladder always may not have the trabeculations. Overactive bladder definitely will be having trabeculations. Unobstructed detrusor with the impaired contractility is the cause for the trabeculation. And the bladder diverticulum is where there is a bladder will distend into a circular, what we call the pouch-like structure, that is a diverticulum. Again, it is because of increased intravesical pressure from 150 to 180 or 120 to 150 center, what we call the centimeter of water. Okay. So there is unit to Granthir Ashmari Lakshana. So this usually this has been given. Granthir Ashmari Lakshana means the Ashmari in the what you call vesicle calculi, what the presentation will be there. In the same way, there will be presentation with the Mutragranthi. So within a sonography, you can make out whether the stone is there or not, calculi is there or not. If there is not calculi, then it should be considered Mutragranthi. Okay, Mutragranthi. Ninth one is the Mutraghata, that is retrograde ejaculation. So usually, basically, what happens when there is an urge for the urination, at the same time, patient indulges in sexual intercourse, then his semen is suddenly discharged and mixed with the urine. Okay. Okay. But during the orgasm, what happens? The same muscle contracts to keep ejaculate from the entering into the bladder. Okay, the bladders which are closing the the muscles which are closing the bladder, which are not allowing the what you call the perineal muscles, which are not allowing the ejaculation to go into the bladder, they are functioning, and there is a orgasm is there. But when there is what you call the urination, the patient has indulged with the ongoing urge of urination, and at the same time he indulged in sexual intercourse, there will be a retrograde ejaculation because the muscles fail to contract. Okay, it stays relaxed because the ejaculation ends up in a bladder, and that's leads to called as a dry orgasm, and that backflow of semen into the bladder during ejaculation owing to incompetent bladder mechanism. Okay, so that's why this one, Mutra Shukra, can be considered as retrograde ejaculation. Okay, because of the indulgence of the patients with an ongoing urge of urination, and but even with that, if they're indulging sexual intercourse, they may come across this. And the ash water, it looks like an ash water, that is Mutra Shukra. Okay, the 10th one is the Ushnavata. The 10th one is the Ushnavata, that is cystitis can be compared, urethritis can be compared, prostatitis can be compared, hematuria can be considered, dysuria can be considered. Okay, so any of these cases can be considered under Ushnavata, and accordingly, the treatment can be given. Okay, So in Ushnavata, Pitta is the one which gets vitiated because of the Vata. Okay, causing burning sensation and pain in the bladder, penis, and rectum, and passes urine with difficulty, yellow colored urine, high concentrated urine. Okay, and it may be also mixed with blood or frank blood, and even it may turn out to dark color urine. Okay, and these are more common with the cystitis. These are more common with cystitis. Okay, so Mutra Kasada 11th and 12th, that is the Pittaja Mutra Okasada and Kafaja Mutra Kosada, they have got the features, okay, which are again like urethritis, they mimic the urethritis, crystalluria. In case of Pittaja Mutra Kosada, the urethritis and crystalluria, the same signs and symptoms are seen in the Mutraja Mutra Okasada. The burning will be there, burning micturition will be there, okay, the pain will be there, okay, and crystalluria, there is a cloudiness in the urine because of the crystals will be there. So that is aukasada. Mutra aukasada means the cloudiness in the urine. Cloudiness in the urine. So that is why the pittaja mutra, it is with the burning, then it is called mutra, pittaja mutra kasada. If you are able to see the more turbid urine, okay, more what you call the cloudy urine with more crystals, and if with the burning, if it is pittaja mutra kasada, and if it is without burning, it can be kafaja mutra kasada, and pospituria can be compared to kafaja mutra kasada. Okay. Now coming to the general treatment. Okay, general treatment. Usually, whatever the classics has shown is, of course, they are speaking about the what you call the first internal medication. They are speaking about the internal medication. So basic first thing they are told is kashaya. So the kashayas, that's why I told you, when I was treating that BPH patient, I was giving internally as Dashmul Kashaya, I was giving Yoga Basti as Dashmul Kashaya, Nirobasti, and Dashmul Taila as Nirobasti. So Kashaya happens to be the best medicine. First form of medicine can be Kashaya. Of course, depending upon the conditions, you can just select from the other, what we call the formation of the medicines, that Kalkas, Sarpi, okay, Leha, all those things are there. Even Kshar Prayog is mentioned here, okay, and the, what you call the Basti Prayog is mentioned. The basic thing, either Shodhana or as a major, what you call the karma, if you want to do, that is the Basti karma, that too also, the classic says that Uttara Basti should be performed. But I could perform only Gudabasti, and even then I could get the good result. So if you are not competent enough, if you are not confident enough, if you feel that your facility is not what to call the good for the Uttara Basti, because Uttara Basti has got its own complications. It can be even the anaphylactic shock can occur. Vasovagal shock can occur with the Uttara Basti if it is not properly performed. Then the delayed complications are the UTI, what you call the urinary tract infections are more common with the what you call the Uttara Basti. So because of that, many of us we do not practice Uttara Basti. No worries, no worries. Even with the Guda Basti, you can do wonderful, what you call, you can get wonderful results. Because I practice it, I'm still practicing the what you call the Guda Basti, especially Yoga Basti, combined with the Kashayas, okay, and the Niro Basti, especially Niro and the Matra Anuvasana Basti, and that has given me a good result without the complications of Uttara Basti. Okay, so the best thing what you're supposed to use is the Grita, and this particular thing should be followed. The first primary or the best medicine or the form of medicine can be used is Grita form, okay, which can be added with Kshara and Kashaya, Kshira in and the same combination can be internally used, can be used in the Basti, okay, as well as in the Uttar Basti. Okay, so because the Uttar Basti, even though Pitta is involved, it can become subsided. Okay, so other rest of the medicine, management follows the Ashmari Chikitsa. So basically, I would like to conclude like this. I would like to give one gist. That is, whenever if you are very much sure, when you understood that there is no morphological changes which may require surgical intervention, when you see that there is no life-threatening morphological change, I am speaking life-threatening morphological change. When there is no fatal condition, when there is no particular thing which is going to make the worsening of the systems of the urinary system, especially what you call the retrograde hydronephrosis and causing the renal shutdown, if such conditions are not existing, and when the urine flow is even though obstructed acutely, but integrating the modern medicine, what you call the equipments, especially with the catheterization, you can go with Ayurvedic Basti treatment. The basic thing what you need to do is do the Vatanulomana. If you do Vatanulomana, any of the Mutraghata can be easily taken care. And once if the acute retention of urine is there, the first thing you need to do the bladder emptying with the catheter, and that catheter should be kept there till you correct the basic pathology with the Basti. So ideally 7 to 10 days, the catheter should be kept in the bladder till your Basti drug starts acting. Okay, so I would like to give my 3 case studies here, which has given me the results, and which by this going through this, you can get a confidence that even increased prostate size can be reduced by the only Yoga Basti. Okay, so case number 1, I had a 66-year male patient having sonographical finding with a prostate of 69 grams. And he was having acute retention of urine repeatedly. He suffered with that, and because of that, he was applied a catheter, and he was advised for TURP, as I told. And we applied Dhanyaka Gokshara Ghrita plus Evakshara. Okay, Dhanyaka Gokshara Ghrita, 60 ml plus 5 gram of, 5 gram of Evakshara. We gave the Matra Basti for 7 days, followed by, after 7 days of Matra Basti, we switched over to Yoga Basti with Punarnavadi Kashaya Yoga Basti. Okay. Where the Anuvasana is again with the, what you call the, either the Dashimula Tail you can select, or you can, if the patient is affordable, go for the Gritas, because Gritas have been told best for the Mutraghata. So any Madhura Siddha Siddha, Grita or Taila can be used for Anuvasana Basti. Okay. So Dhanyaka Goshur Grita can be used even in the Anuvasana Basti as a Sneha. And even in the Sneha, when you are preparing the Nirva Basti, as well as the Anuvasana Basti separately. Okay. So, of course, you can give internal medicine. So, internal medicine, I used to give the, what you call the Gokshuradi Ugulu, Trifla Ugulu, if sometimes Kanchana Ugulu, and Dashimula Kashaya internally, or Varnadi Kwata, depending upon the prostate size. Okay. So, ultimately, there should be Shotahara, there should be Vatanulomaka, and they should be what you call the Balya. If you use any of these combinations, with this particular properties, any kashayas, any gugulus, okay, gugulu kalpas, you can definitely get a good result. So the result what I got was, after 7 days, we removed the catheter, and as I told, the uroflowmetry shown significant result, and the prostate size surprisingly reduced to 39 gram from the 69 gram. Sonographical reports are there. And since 2018 December, this episode happened and we treated him. And since then, the follow-up is going on. Patient calls on phone. He expresses gratitude, and he is not suffered with any relapse of the condition. So we could save him from TURP. Because TURP has got its own complications. It has got its own recurrence rate also. TURP is not the ultimatum. So when I could help the patient without TURP to live his normal life, okay, so that is the great thing what we can do. Case number 2, 72-year male patient, again referred by that first patient, okay, prostate was 65 gram, and again the same episode, the same scenario was there. With the catheter he came to me, and of course he was advised TURP, and we did what you call the Dashimula Yoga Basti, Dashimula Kashaya Yoga Basti for 7 days, followed by Punarnavadi Kashaya Yoga Basti for another 7 days. So total 16 days we did, 8 rather, Karma, what you call the Karma Basti we did. Okay, and we could consolidate the result. So on the 7th day we took the catheter, and patient was able to pass the urine, and the prostate size reduced to 45 gram from the 65 gram. He is under follow-up since 2019 January, and there was one time that there was a another repeat sitting was done, at September 2020. Okay, where prostate, because he reported again with the increased size of the prostate, 69 gram in September 2020. So another sitting was given. Again, there was a reduction in the size of the prostate and the symptoms reduced. That means the prostate is going to again grow. It's not permanent remedy we are going to give. But if you keep on repeating this sittings of the Yoga Basti, at least once in a year, twice in a, I mean, so biannually, okay, that is what the patient only has to invest 16 days or 7 days, depend, and almost around 5 to 10,000 rupees. And he will have, without surgery, he will have better result with the prostate, what is benign prostatic hyperplasia. And case number 3 is the 38 years male patient diagnosed as a neurogenic bladder, atonic chronic retention of urine with overflow incontinence was there. And there was a history. I was not sure. I didn't have the much of the reports, but there was a history as per the patient. Patient was telling that he was subject for surgery, and he was at 8 months old at the what we call the spine region. So maybe meningomyocele. I don't know. It is my guess. And because afterwards, and his particular urine flow rate was reduced it is acquired in the middle in the 30s, in the third decade he reduced with this. He came with this complaint, and the catheter was removed to assess what was the urine flow rate on the day of admission, and it was only 2.7 ml per second with the voided volume 12.9 ml. So he was able to only void 12.9 ml with a rate of 2.7 ml per second. Okay, so on the day of admission. Again, we gave Punarnavadi Kashaya Yoga Basti along with internal medicines. Internal medicines, again, as I told you, all those, whatever they do, Shotahara, Vatanalomana, Agnidipana, Ampachana, you can use it. Okay. So result again the same, that on 7th day of Yoga Basti, uroflowmetry after treatment reveals the 4.1 ml per second increase in the flow rate. So almost double. Okay. Almost double. And the voided volume was 59.5 ml. 59.5 ml. Okay, which reduces the frequency of nocturia because patient was having increased frequency of nocturia. Unfortunately, there was a little reduction in the frequency of nocturia because the patient can have a little bit of good sleep. So his quality of life improved. Okay, so even incontinence urgency was also improved. Okay, so he is quite all right since 3rd February 2021 till date. Patient was admitted on 1st March 21 for second sitting of Yoga Basti. Means even because the complete result was regression was not there, so we are supposed to repeat the things. Now the question is, why did I get the result? Okay, so basic pathologies I told you, that is all thing is because of the increased intravesical pressure, and that is leading to some morphological changes, and because of there is a further obstruction to the urine flow either at the site co-ureteral junction or at the bladder outlet, and because of that there is the Mutraghata, and as per us it is Mutra Udavarta because of secondary to Vata Udavarta, Vata Vimargamana, because of the Vega Dharana. So what we did, we are doing it at Samprapti is there is a Vata Vimargamana, Udavarta Lakshanas are there. Okay, and because of that there is the ill effects are there on the other systems also, like especially GIT. Okay, and because of that we opted for the Basti, which can do Vatanulomana. Now the development of the bladder as well as the rectum, they come from the same point, same segment, that is cloaca. They come from the same segment, and because of that they share the same nature, character. Okay, and they respond with each other. That's why there is, if the urine retention is there, there may be constipation. If the loaded rectum is there, that can cause urine retention. If the intestinal obstruction is there, there is a renal shutdown. Because they are interrelated. That's why even our classics, they say that Mutrotpatti takes from Pakwashaya, and that poured into the bladder. So Pakwashaya, as I was telling, the upper tract, what the modern urology considers, the kidneys and ureters, Can't we consider them under the Pakvashaya? Because they are coming from the origin from the same bud, that is cloaca. Okay, at the 6th week, you can see there is a urethral bud is there. Okay, and rectum is there. Rectum is at the 8th week. The rectum is developing from the same cloaca. Okay, so that is why the Basti acts here. And the only simple line of treatment is do the Vatanulomana. You need not to go break your head with all the classical or the complicated slokas. You do Vatanulomana. That will give you immense result for all the Mutragatas. Of course, when it is ruled out that there is no any structural entity in at once requiring surgical intervention. So as long as it is a functional anomaly, you can do wonders with the Ayurveda Basti treatment, Ayurveda internal medication, which are focused to do the Vatanulomana and Udavartavat Chikitsa. If it is done, you'll get the result. Okay. So summarize. Let me summarize this. So we can summarize like this. Vata Kundalika. So whenever you can get a patient, because no patient will come with a diagnosis of Vata Kundalika. Patient will come to you with the diagnosis of diverticulum, either vesical diverticulum or as a bladder outlet obstruction or as a vesicular reflux. Okay. Then try to think on the aspects of whether Vata Kundalika Lakshanas are existing there. If the patient has come with a diagnosis of BPH, benign prostatic hyperplasia, or any CAs, any tumors, can be considered Vata stila. And even in case of CAs, especially metastatic conditions, when the surgery is not remedy, when the patient has been left out by the contemporary people, that because there is a multi-system, what we call multi-organ metastasis is there, patient is not going to undergo surgery, is unfit for surgery, and patient will be only on chemotherapy or radiotherapy, and even that will have limitations. And at that condition, the patient comes to you, whether you can do any help from the Ayurveda, definitely you try with these bastis. At least we can improve the quality of life. Our treatment can become a palliative treatment. Who knows if the miracle takes place, if the patient has got a very good Daiva Bala and Karma Bala, if even CA can be reduced to the minimalist things, or patient will have better life expectancy. Because I was treating a patient of what you call the colon cancer. Patient was reluctant. He was never wanted to go for surgery because he was almost 80 years. And he told that I would like to die without surgery. So you can try with Ayurveda. And I was trying with the Basti again. And I got I could improve his life as long as he was alive. Okay. So third is whenever patient comes with a chronic urine retention or vesicular reflux, think over whether it is a Vata Basti. Neurogen, if the patient is having neurogenic bladder, always plan your management on the basis of Mutraghata. If acute retention of urine is there, Mutraghata. If anuria, acute nephrotic syndrome, then you can go for Mutra Sangha. Oliguria, Mutra Samshaya. Mutra, and if a trabeculation of bladder wall is noticed in the endoscopy, and the urologist has mentioned it as a trabeculation, cellulose, diverticula, or mucosa, then I can Mutra Grunti. And if the retrograde ejaculation has been noticed, then Mutra Shukra. If cystitis, urethritis, prostatitis, hematuria, dysuria can be treated on the basis of Ushnavata. If the urethritis and crystalluria, Pittaja Mutra Kasada, and the only difference when it comes to Pittaja Mutra Kasada Ushnavata is in Ushnavata, the hematuria will be more prominent, whereas in Pittaja Mutra Kasada, only what we call the cloudy urine will be there with the burning. So no hematuria. Okay. So when it is more of hematuria, go with Ushnavata management. If it is cloudy urine, more viscous urine, more turbid urine, go with Pittaja Mutra Kasada when the patient present with Daha. And Kaphaja Mutra Kasada, that is phosphochuria. Okay. So can we now conclude like this? That Mutraghata are more of bladder functional pathology. Isn't it? Because surgery has not been mentioned by the surgeon or Sushruta. Mutraghata are more of bladder functional pathology. Whether it is acceptable to limit Vata stila to any BPH, what is your opinion? Whether we need to restrict Vata stila only to BPH? I think No. We should think of the other conditions which will present with the same vertical presentation. Okay. Then classical application of Uttar Basti and Basti can give better result in the functional analysis. So if you're competent enough to do Uttar Basti, you can go ahead with the Uttar Basti. That will give better result. But there's no less result with the Guda Basti. So Guda Basti anybody can practice in your clinical practice. So extensive research on the classical remedies and their implementation is needed, is the need of the hour, especially for the non-surgical management of the surgical disease. Okay. So non-surgical as well as age-related pathology of the urinary system. Okay. So these are the references. So that is all from my side, and I was a little bit fast. I hope it has not obstructed you from gaining knowledge what I wanted to share, because I need to conclude in the time what is permitted, because all of you are investing your own time, and you must have come with a mindset of 1 hour. So I wanted to do that. So even then it has extended 20 minutes. I'm sorry for that, but I feel that it was worth to do that 20 minutes extra with related to Mutraghata. If you agree with me, kindly type yes in the chat box, and that will become that can and you can send your feedback, and you can have, if you have got any questions, you can put in chat box so that I can address it. If I am able to answer, I will answer. Otherwise, at least I will look into that aspects. So I request all of you to put your opinion or your questions in the chat box. Okay, I'll wait for another 5 minutes. So if any questions come, I would like to address them as much as possible, what are the capable I am. So let me stop my screen sharing so that I can see you people. So I'm waiting for any questions in the chat box. Till now, there are no questions in chat box. No feedback also. I request you to give some feedback. How did you feel about the session? Whether it was really useful for you people, whether it was worth time spending with for you people for the last 1.5 hour. I enabled the message chat. Thank you, Dr. Naveen, yes, for your feedback. If you have any queries, you can put. Otherwise, okay, still another 2-3 minutes. I will wait. So in that time also, if you got any queries, you can. In the meantime, I would like to request you to subscribe to my YouTube channel, Ayurpreneur Academy. Okay, sir, I'll be uploading these sessions till December. Till December, I'm making it everything free to help my fellow Ayurveda people. So YouTube, it will not be enlisted in the YouTube channel. You can get access to this, and you can share that to any of your friends who could not attend this session today, even though they must have registered or they may not have registered, but if found it is useful, I request you to subscribe to my Ayurpreneur Academy YouTube channel so that you can access the other sessions which I am already uploaded there. Okay. And every Friday, I am trying to come with a new perspectives, what my perspectives are regarding the Ayurveda, and I'm trying to convey it through this particular platform of Ayurpreneur Academy, which is my dream foundation or the academy, where I would like to help all the Ayurveda professionals to have what you call the simplified Ayurvedic formulations and the management, what you call the protocols, where they can help their patients, and by that they can become significant using Ayurveda in the profession as well as in the society. And at the same time, I would like to tell you, say that I have got my community, Ayurveda Lifestyle Hub community, which is a lifetime membership community where I'm trying to build a community of Ayurveda professionals who are ready to collaborate with fellow Ayurveda people to grow together. It's like a business networking. Okay. So internal, what you call the references, internal, what you call the helps can be taken. So I have got my own Ayurpreneur business model, wherein the different 7 sectors have been used as a model, and there whatever people, either the people, our own graduates and postgraduates, if they resonate with that particular business model, and if they brand themselves and they become expert of any of these seven, what you call the verticals of my Ayurpreneur business model, so that by that they can get an branding, they can get in a positioning, and at the same time they can help the other people who are in the other niche or other, what you call the vertical of the Ayurveda business model. So by that, mutually, all the seven, what you call the uh, vertical people can help each other, so that the community will be flourishing and all of us will be flourishing. So this community is to, okay, this community is for what you call making a contribution by collaboration, not the competition. Because my Ayurvedic business model suggests you, it has got the membership levels, the silver membership, gold membership, and diamond membership, where you can access. Now only silver membership is live and bronze membership is live. If you subscribe for bronze membership, which you will be getting access to Ayurpreneur Academy. Okay. Whereas if you subscribe for silver membership, which is a level one membership, you can get access to the Ayurpreneur Lifestyle Hub community. Because in after December, I am trying to go for Ayurpreneur business, what you call the Ayurpreneur Academy members. Only monthly one session will be there. Whereas for Ayurpreneur Lifestyle Hub members, weekly sessions will be there. And I will not be the only person to deliver the sessions. I'll be calling different experts from the different arena. Okay, the seven verticals what I identified. Okay, integrative medical practice, pure Ayurvedic practice, coaching, startup, techno-driven Ayurveda farming, and Ayurveda authorship. So these seven verticals are these are the spokes of my Ayurveda business model. So I would like to help all the Ayurveda graduates and postgraduates, whatever I know, because I went through all the trainings as much as possible. And that can be, if you resonate, if you are more passionate about technology, how you can use your technology for what creating an entrepreneurship in Ayurveda. If you are very much passionate about the agriculture, how it can be made into entrepreneurship. If you are very much passionate about the writing, okay, how it can be an entrepreneurship can be done. If you are very much good with the coaching, how it can be used to make your own digital entrepreneurship. So all these things are explained. The pre-recorded courses are there in the silver membership, which is worth with 1,39,983. But it has been with to help, because I have a mission to help all the Ayurveda graduates, at least especially the 1 million Ayurveda graduates I would like to help to live, achieve and live entrepreneurial lifestyle using their Ayurveda knowledge and their passion to accomplish social significance, which we are not getting, professional significance, which we are not getting. We are not respected by the contemporary people as we respect them, and achieving the financial abundance and time freedom using our Ayurveda business model. Okay, so for that reason, I have kept it very minimal rate, that is 4,999, to get in a lifetime membership for Ayurveda Lifestyle Hub, where you'll be getting almost 17 course bundles as Ayurveda business model, and weekly calls like this. And I am planning for a challenge, Ayurthon challenge, where 90 days you can take up a challenge and you can accomplish your one basic, what you call minimum viable product or project, which can help you to become an entrepreneur. Okay, so I'm planning that. So maybe that may be launched around 25 January. So till then, the 8 courses are live in the silver membership. The other seven courses I am preparing. So total 17, and plus two courses from this bronze membership are also included in the silver membership. So if you once you enroll in silver membership, you'll get access to bronze membership also, there, which include two courses, that is Ayurpreneur Success Blueprint and Ayurpreneur Device Goal Setting Formula, where you can decide your goal. What should be your professional goal? What should be your family goal? What should be your financial goal? What should be your other travel goal, or all things. So that is what, with that mission I have started. It was so if I would like to request you to visit the our website, that is www.ayurpreneur. I am typing in the chat box, Ayurpreneur Lifestyle Hub.com, where you can directly enroll for the silver membership. Or if you already downloaded Ayurveda Lifestyle Hub mobile app in your mobile, there is a front store is there, front store. There also you can get access to any of the membership you would like to buy, you would like to purchase, and want to be a contributor for the Ayurpreneur Lifestyle Hub community, and want to be creating, means joining your hands in the creating the universe of the Ayurpreneurs. Okay, so thank you for joining. Thank you for joining today's session. So already you're joined here, so you need not to register whenever, because next week also I'll be making a member, what you call the, I'll be floating what you call the registration form. So you need not register. You will be included in the next session without registration. Also, you'll be getting notification and link at the feed section of Ayurpreneur Lifestyle Hub mobile app. So keep a watch on feed section, or even in your email, you'll be getting link for the joining next in all forthcoming Friday mastermind sessions. Okay, so thank you for watching this one, and there are no questions. And thank you, Dr. Sanjay Gupta ji, for your wonderful feedback. It was very informative session, sir. You explained nicely through both Ayurvedic and modern perspectives. Thank you, sir. Thank you. And I am happy that I could add some value to your Friday evening. Okay, so thank you for being with me, and see you next week with the what you call the new topic. Okay.